The title of this tutorial is Muscles that Move the Arm. This is the third and final section of this series. My name is Carlos Andres Suarez-Quian, and I'll be the narrator of this tutorial. This work was produced while on sabbatical leave in the laboratory of Dr. Manuel Eugenio Dorado Ocaña, Associate Professor in the Department of Anatomy and Embryology at the University of Sevilla, Spain. This tutorial is solely for educational purposes and is not meant for reproduction, posting on the web, or to be used for commercial purposes. Let's begin. Previously, we described the muscles that move the arm, their innervation, and their specific actions. The objective of this tutorial is to describe the movements at the glenohumeral joint in terms of specific muscle action. As before, let's review the actions that occur at the glenohumeral joint. These actions include medial and lateral rotation, abduction and adduction, and flexion and extension. In addition, if you're trying to throw a ball, you would undergo abduction and adduction, and flexion and extension, together known as circumduction. We start our discussion by looking at the muscles responsible for medial rotation, then describe the muscles that produce lateral rotation. 4 muscles cause medial rotation, 2 located anteriorly and 2 located posteriorly. These are the anterior divisions of the deltoid, the pectoralis major, the latissimus dorsi, and the teres major. In contrast, 3 muscles bring about lateral rotation: the posterior division of the deltoid, the infraspinatus, and the teres minor. Let's look at the muscles that cause flexion and extension. The anterior division of the deltoid, the pectoralis major, and the coracobrachialis act as flexors of the glenohumeral joint. The posterior division of the deltoid, latissimus dorsi, teres major, meanwhile, cos extension. The last two independent actions at the glenohumeral joint are abduction and adduction. As described previously, the supraspinatus initiates abduction up to 15 degrees, followed by the action of the intermediate deltoid up to the horizontal. In reverse, the pectoralis major, latissimus dorsi, and teres major function in adduction. Finally, by combining flexion, extension, abduction, and adduction, we get circumduction. And here again we show flexion, extension, abduction, and adduction. At this point in the tutorial, we have identified the individual muscles that act on the arm, their specific actions, and their individual innervation. At this point, it is a good idea to again consider the actions that take place at the glenohumeral joint and list the muscles and innervations of the muscles. Indeed, the salient purpose of this tutorial is to provide the context by which these relationships are of clinical relevance to the physician. Let's list again the actions, muscles, and nerves for these actions. The movements of medial and lateral rotation and the muscles that bring about these specific actions and their respective innervation are presented in this slide. Stop the tutorial and ensure that you know this information. Do the same for the actions of flexion and extension, the muscles responsible for these actions, and the innervation of these muscles. The actions of abduction and adduction are listed. Again, stop the tutorial and ensure you have mastered the information included in the slide. This now concludes the tutorial on the muscles that move the arm. None of this work could have been possible without the generous gift of the body donors. I remain humbled by their humane gift. Special thanks must go to Mr. Mark Savonia, who does the incredible work of embalming the cadavers. His skill is obvious in the images. Thank you. We acknowledge 3D4 Medical for the muscle animations used in this tutorial. Finally, you can use your QR reader to look in Apple iBooks, where you will find flashcards, ID questions, and higher order problem-based questions relevant to this tutorial.